Now let's talk about each chamber of the heart one by one. First, let's talk about right atrium. Right atrium. This is right atrium from anterior view. This is right atrium from posterior view. Here, right atrium receives deoxygenated blood from all over the body. It collects blood from all over the body through superior and inferior vena cava that we'll talk about it in physiology of the heart. Okay. Its external feature is that right atrium is thin. Okay, it makes right border of the heart. This is the right border of the heart. It makes a small part of anterior surface of the heart. Okay, it extends from superior vena cava up to the inferior vena cava. Plus, its blood capacity is around 100 up to 130 mLs, and its blood pressure is 0 up to 5 millimeter mercury that you'll talk about it in physiology. Don't worry. From the outside, here this is this small projection of the right atrium from the right up to the base of the aorta, up to the and part of the root of aorta, and it overlaps the root of aorta. This is called right auricle, and right auricle means small ear. Okay. Now, listen me carefully. For example, like this, like this, okay, like this. This is the right. This is superior vena cava. This part, okay. Let me explain it clearly. This is superior vena cava. This is inferior vena cava. Superior vena cava, this part. This is superior vena cava, okay, and this is inferior vena cava. Here, from the outside, in this part, okay, in this part, in this anterior part, here we have a groove from superior vena cava up to the superior vena cava, inferior vena cava. Here we have a groove in this part, from superior vena cava up to inferior vena cava. In this part, we have a groove, and this groove is called sulcus terminalis. This is called sulcus terminalis, which extends from right part of superior vena cava up to the right part of inferior vena cava. This is very important because this is sulcus terminalis inside it. For example, listen me carefully. Inside it, in this part, inside it, from outside we have sulcus. From inside, beneath the sulcus, we have a bulging of muscle, okay, and this bulging of muscle, for example, this from the outside, this inside we have a bulging of muscle which is called cresta terminalis. So from outside we have sulcus terminalis. Inside to it, when you watch it from the inside, we have a bulge which is called cresta terminalis. So now I'll cut this right atrium from the anterior part and exactly in cresta terminalis. So when I cut, for example, this is right, this is heart, okay, this is right atrium. When I cut it here, okay, when I cut it here, listen me, this is, for example, inside, and this is sulcus terminalis. When I cut here, so like this, I'll open it like this. So when I open this will be terminals. Once again, this this is from the outside, this part from the outside, this is sulcus terminalis. From the inside, this is cresta terminalis. When I cut it here and I open it like this, so this will be cresta terminalis, okay, and this will be anterior part, because this anterior, this will be anterior part, and this will be posterior part of right atrium. Now, this anterior part of right atrium is made of irregular muscles, and which is called pectinate muscle. The posterior part, this is anterior part. This posterior part is a bit smooth. Okay, now let's talk about each part of this one by one. First of all, in this smooth part, at the upper end of cresta terminalis, here at the upper end of cresta terminalis, we have a specialized myocardium, which is called SA node or sinoatrial nodes, that we will talk about it under the conductive system of the heart, which generates impulse and depolarization and repolarization to the heart and causes contraction of the heart and causes production of heart rate. We'll talk about it in history. So this one anatomical point, this one important point. In smooth part, in this inferior part, there is opening of inferior vena cava, and near the opening, here is opening of inferior cava. Near the opening of inferior vena cava, we have a valve. Okay, and this valve is called where I wrote it. This valve is called here. This valve is called Eustachian valve. This is called Eustachian valve. Now, in adult, there is no function of Eustachian valve, but during embryological life, okay, it leads the blood of right atrium directly to the left atrium by the help of this foramen, which is called foramen oval. We know that during the fetal life, there is a foramen between right atrium and left atrium, which is called foramen oval. So this valve helps the blood of inferior vena cava to go easily from right atrium to the left atrium. But when during adultness, this foramen is closed, and there is no exact function of Eustachian valve. Okay. So about the smooth part, superior vena cava opens, inferior vena cava opens, which is guarded by Eustachian valve. Okay, here we have another opening which is called coronary sinus. This opening, this coronary sinus, is between inferior vena cava and tricuspid valve. This is tricuspid valve. This is inferior vena cava. In this point, here in this point, we have an opening. Okay, which is called opening for coronary sinus, and coronary sinus is a great vessel that collects a deoxygenated blood of the heart, and it drains into the right atrium directly through this foramen. Okay, and it has a valve which is called Fabacean valve. This valve is called Fabacean valve. Plus we have in this smooth part some small openings for small cardiac for different veins, the small veins that drains deoxygenated blood of the heart directly into the chambers. We will study about the veins and arteries of the heart under the coronary circulation. Don't worry. Okay, so this was about the smooth part of the heart. About the right part of the heart, the smooth part of the heart is also called sinus venerum, and rough part or anterior part of this right atrium is also called atrium proper or pectinate, a part that I mentioned it before. It has some muscular rays. Okay, muscular rays. We will talk about rays in pillar later on. Okay. Okay, we studied also about the cresta terminalis. Okay, and about the interarterial septum, this is atrium, this is another atrium. Between two atriums we have a septum. Okay, you can look at here, this is the interatrium arterial septum, because posterior to this we have left atrium. For example, this is right atrium, this is anterior part. From this part, this is posterior part. So here we have left atrium, this is right atrium. Behind this we have left atrium. So this is interarterial septum. Two important structures in the interarterial septum between these two septum. For example, this is right atrium, this is left atrium, this is right ventricle, this is left ventricle. Okay, this septum between two atria is called interatrial septum. Now, because during embryogenic life, we have here a foramen, and this foramen is called foramen oval. This is called foramen oval. Okay, now when it closes during adolescence, okay, here a fossa will be made, and this here a depression will be made, okay, from this side and from this side, and this depression is called fossa ovalis. Okay, so here is a depression which is called fossa ovalis, and I'm not going deep into the foramen oval because it's made of two septum, septum primum, septum secundum, and this is closing by and this will be closed by septum secundum. Okay, now anyway, here the remaining part, here is an overlap of septum secundum. Okay, let me explain the septum secundum in primum a bit. This is the first septum. Okay, this is the first septum which will be made during embryogenic life between two atria. This is called septum primum because it's the first septum. Then here foramen will be made, which is called foramen primum, the first foramen. Then it will be closed, and here a foramen will be made, and this is called foramen secundum. And then another layer of septum will be made here. This layer is called septum secundum, and here we have a foramen. So from this point, this foramen like this. Okay, this foramen, this S-like structure, this is called foramen oval. Now after embryogenic life, okay, this septum secundum and septum primum will be attached to the septum secundum. Okay, and here we have this fossa, and this fossa is called fossa ovalis. So now this remaining part of septum secundum that overlaps this fossa, this is called limbus or annulus ovalis. Okay, don't confuse fossa ovalis. We can watch it also from the right, from the left ventricle, from this side also, that we'll talk about it later on. So this was about right atrium. So now here we have an orifice between right atrium and right ventricle. Watch it here. This is right atrium, this is right ventricle. Here this is orifice between right atrium and right ventricle, which is guarded by a valve, and this valve is called tricuspid valve. We will talk about tricuspid valve later on. Okay, so this was all about the right atrium. Now we will talk about the right ventricle. Okay, a little bit information about the triangle of Koch. Triangle of Koch is located in right atrium, and in triangle of Koch, AV node or atrioventricular bundle is located. Okay, which is very important part of conductive system. So let me tell you about the boundaries of triangle of Koch. For example, this is the boundaries of triangle of Koch. Okay. Here we have a tendon, a microscopically tendon, which is called tendon of Todero. This is called tendon of Todero. Inferiorly, we have here sinus. Okay, we have here opening of coronary sinus. So it's one boundary is tendon of Todero, another boundary is opening of a coronary sinus, and another boundary is this leaflets, specifically this septal leaflet of tricuspid valve. This septal leaflet of tricuspid valve. So tendon of Tedera, septal leaflet of tricuspid valve, and opening of coronary sinus. These are the boundaries of triangle of Gog. Got it? Now, let's talk about right ventricle. Okay, first, it has a crescent shape. Okay, for example, like this, it has a crescent shape. Okay, this is the right ventricle. It makes two-thirds of sternocostal surface. This is sternocostal surface. It makes two-thirds of sternocostal surface, and also it makes one-third of diaphragmatic surfaces. Diaphragmatic surface. It makes this one-third of diaphragmatic surface. Okay. Plus, it makes inferior border of the heart. Okay, so now it is divided into two important parts. Okay, its inflowing part and its outflowing part. Watch it here. This is right ventricle, this is inflowing part, this is inflowing part, and this one is outflowing part. Okay, so in inflowing part, this is the inflowing part, we have a lot of irregular muscles inside it. These are irregular muscles inside this, and these are called trabeculi cornea. These are called trabecular cornea. Okay, so this inflow part of right ventricle is separated from the outflow part of the right ventricle by a boundary of a muscle of a thin ridge, which is called supraventricular crest. Okay, and its outflowing part is smooth, its inflowing part is guarded. It has an orifice which is called this orifice in inflowing part, which is called tricuspid orifice, which is called atrioventricular orifice. Okay, which is guarded by tricuspid valve, and its outflowing part is it has an orifice which is guarded by pulmonary valve. This outflowing part, this red outflowing part, this is also called infundibulum. This is also called infundibulum. Okay, now Yes. Now, what are trabeculi cornea? Okay, we have three terms here. One is called ridge, one is called bridge, one is called pillar. Okay, what are the differences between ridges, pillars, and bridges? Okay, for example, this is the wall. This is the wall of the ventricle. Okay, now we have a muscle, a band of a muscle which is connected to this wall throughout its length. This is called ridge. This is called range. But when this bundle of muscle is connected to into two parts, into two ends, for example, in this part and in this part, and it like this, so this middle part is free. Now this is called bridge. This is called bridge. But this type of muscle, okay, this type of muscle extension small, this one is called pillar. So this one is bridge, ridge, this one is bridge, and this one is pillar. Okay, this is very important point in anatomy, because first of all, we have a beautiful ridge which extends from, listen it me carefully, which extends from this interventricular septum up to the papillary muscle. Which papillary muscle? Anterior papillary muscle. We'll talk about papillary muscle. Don't worry. This ridge is called moderator band. This one is called moderator band, and this is very important because in moderator band a part of right bundle branch passes to the right ventricle. We have AV node and AV node, then we have bundle of Hess, then this left bundle branch, right bundle branch, a right part of right bundle branch passes from the left side to the right side through this moderator band. This one important point about the papillary muscles. Here, watch it here. This is a tricuspid valve. You study about. Let me explain it now. when you watch this valve, so it has one cusp, two cusp, three cusp. Each of these cusp is called leaflets. Okay, leaflet. So this one leaflet, two, it's a second and third leaflets. That's why this is called tricuspid valve. Now, this tricuspid valve is connected to the wall of myocardium or to the valve of ventricle through these connective tissues. These connective tissues are called chordae tendineae. These are called chordae tendineae. Okay, and chordae tendineae is connected here to a pillar-like structure which is called papillary muscle. So here we have three papillary muscles. One is called anterior papillary muscle, septal papillary muscle, for example, septal papillary muscle, anterior papillary muscle, and posterior papillary muscle. And all of them are connected to this valve. It has an important function. When this ventricle contracts, it pumps blood to the lungs through these pulmonary arteries. Now, when it contracts, this valve is bulging to the backside or to the inside of right atrium. Right atrium, because here we have a lot of pressure, we generate a lot of pressure. Now, this chordae tendineae prevents from the bulging of these valves to the right atrium. For example, and this is valve. Okay, they will close like this, and when you generate a lot of pressure, so due to this pressure they will bulge like this. When they bulge, they will allow a lot of blood to the right atrium, but normally this doesn't occur because here this leaflet is connected by the cardiac tendon to papillary muscle. When you generate a lot of pressure, so during the contraction they will not bulge to the back side. They're tightly held to this papillary muscle by these cardiac tendinae. In some condition, these cardiac tendinae will be ruptured and causes bulging of this valve, and this condition is called valve prolapse or regurgitation, and this is a disease. Okay, a valve disease. So that's why this is very important. And these cardiac tendons are made of connective tissue, plus they are covered by endothelium. This is also important point in histology. Got it? About the tricuspid valve, it has three cusps: anterior, posterior, and septal cusp. Septal, anterior, and posterior cusps. Okay. About the pulmonary valve, here we have, for example, this one, this is right ventricle. So here we have a valve, okay, between pulmonary artery and between right ventricle, which is called pulmonary valve. And important function of valve is to prevent backflow, to prevent from the backflow of the blood to the previous chamber. This is the most important function of the valve. Okay, so now here we have an important point. This valve is called semilunar valve also, okay, because cusps of this valve has semilunar structure. Okay, now this is very important point. Here in these cusps, for example, listen me carefully. This cusp has this small dip areas, okay, which are called sinus, and they are called small depression sinus. For example, these cusps close like this, okay, like this. For they are not closed like this, they close like this. Okay, so they have these small sinuses. Now when the opens, okay, so when the opens, a lot of blood goes from the right ventricle to the pulmonary vein. Okay, but when they closes, so they will pull once again from the blood, and after pulling these sinuses by the blood, they will come back and they will close easily. So these are called sinuses. Okay, and this sinus has important function an aortic valve which helps us in coronary circulation. We'll talk about it later on. So this was all about the right ventricle. Okay, now we're gonna talk about left atrium. This is easy, the easiest one. This has a quadrangular shape. Okay, it makes a lot it makes the great part of the base. Okay, for example, here, watch it here, this is the base of the heart. So great part of the base of heart is made of left atrium. Okay, so it makes base, it makes upper border of the heart, it makes upper border of the heart, it makes sternocostal surface by its auricle, which is called left auricle. We studied about it, and it has a left auricle which overlaps, this is left auricle which overlaps infundibulum of right atrium. This is infundibulum of right infundibulum of right ventricle. So this auricle overlaps this infundibulum of right ventricle. Also, we studied about this previously. Okay, so here we have a small fossa. Okay, a deep part which is related to foramen valve, which between the interatrial septum. We studied about it previously. Okay, here in this part between interatrial septum, this deep part is related to the foramen oval or fossa ovalis. Okay, so it also has a smooth part plus a rough part. Is posterior inferior part is smooth and its anterior part is rough. Now let's talk about the left ventricle. First of all, a left ventricle has a conical shape. Okay, it makes apex of the heart, it makes less part or small part of anterior surface of the heart or sternocostal surface of the heart. It makes greater part of left surface of the heart, left surface of the heart. We studied about them previously. Okay, and also it makes some borders of the heart. So this ventricle also, this left ventricle also has two parts. This inferior part of the left ventricle, this inferior part of the left ventricle is rough. Okay, and its upper part here, watch it here, this inferior part of the left ventricle, this is upper part which is near to the aorta. Okay, to the aortic valve, this is smooth. Okay, and here we have a valve between aorta and left ventricle which is called aortic valve. Okay, and we have a valve between left atrium and left ventricle which is called mitral valve, and mitral valve has two cusps. It's also called bicuspid valve, and mitral valve is also connected, watch it here, mitral valve is also connected through the cardia tendini to the papillary muscles. Okay, so its lower part is rough. Okay, it's also called no, it's rough. Okay, it has trabeculae cornea. Its upper part is smooth. Okay, or it's also called vestibule part or outflow part. And here we have aorta. Okay, we have two orifices, left atrioventricular orifice which is guarded by the mitral valve, and it has two cusps, anterior and posterior cusps. Okay, and also we have aortic valve. Okay, and in aortic valve we have also cusps which are made of right, left and posterior cusps. Now this is here we have an important, in left ventricle is thicker than the right ventricle, and its ratio is 3:1. Okay, so this is thicker than the right ventricle because it generates high blood pressure. The blood pressure here is around 120 millimeter mercury, and it pumps blood through the aorta to all over the body. Okay, here one important point related to the aortic valve. If we have sinuses, okay, we have sinuses in aortic valve which are called right, left and posterior. We have three valves or three cusps. For example, this is a valve, this one cusp, two cusp, three cusps. So these cusps are right, left, and posterior. Three cusps. Now, in each cusp, we have sinus. So now this sinus is so important because coronary arteries, right coronary artery and left coronary artery, that we will study about it later on, they originates from these sinus. It means, for example, this is aortic valve. This is aortic valve. Okay. Now, from this point here, these coronary arteries originates. Okay. Now, when aortic valve closes, it means during diastole, it pulls it. It will be filled. It will be filled by the blood during diastole. So a lot of blood comes from these sinuses to the coronary artery. So blood supply to the heart is occurred during diastole. This is very important point. And sometimes this posterior sinus or this posterior cusp is called non-coronary sinus cusp also, because from right and left we have coronary arteries, and from posterior we don't have. Don't get confused about sinus. This is sinus, this is valve. Okay. And this is valve. So when this valve is going to be closed or open, this depression is called sinus. Okay, this depression. So it's full of blood. Okay, from here a small pipe comes out, and this small pipe is called coronary artery, from this right and left, and from this posterior there is no pipe coming out. Okay, got it. So this was about sinus. And also anatomically, the middle part of the sinus. Okay, for example, this is this sinus. Okay. Now this this middle part of this sinus is a bit thicker. Okay. And they give a small name for it. And this middle part of the sinus which is thick, this is called nodule, and this thin part is called lunula. Okay. For example, this sinus, this middle part is thick a bit, and these parts are thin. Don't worry about them so much. Okay. So these were all about chambers of the heart. Okay. Now we're gonna talk about coronary circulation. We'll talk about the origin of coronary circulation, that how they originates from these sinuses and how they go and supply our heart. Okay, now before we talk about the coronary circulation, let's talk about the fibrous skeleton of the heart. Okay, listen me carefully. Heart is made of muscle. Okay, and a muscle needs a type of connective tissue or a skeleton-like structure to connect itself and supports itself by it. Okay, so now this heart is made of muscle. This heart is attached to a skeleton-like structure, like our muscles are attached to the bony skeleton. Like this heart is attached to a fibrous connective tissue which is called fibrous skeleton of the heart. Now, let me explain it easily. A fibrous skeleton of the heart, for example, this is right atrium, this is left atrium, this is right ventricle, this is left ventricle. Now, first of all, this fibrous skeleton of the heart separates atriums from the ventricles. Okay, so it separates atriums from the ventricles. Before I mention its functions, let me explain its basic structure. Now, this fibrous skeleton of the heart, when we cut it and make a diagram and we watch it from the superior part, we can watch two things in fibrous skeleton of the heart. First, we can find rings. Rings. It means, for example, this is a ring. Okay. To this ring, this valve is attached. For example, this is mitral valve, this tricuspid valve, this attached to this ring. This is mitral valve, this attached to this ring. So these valves are attached to these rings, and these rings are also called annulus rings or fibrous rings. Okay, now if we have a fibrous skeleton is made of four fibrous rings, one ring, second, third, fourth. This ring is for pulmonary artery, which is called fibrous ring for pulmonary artery. This one is for aortic valve. This one is for bicus valve or mitral valve, and this one is for tricuspid valve. So for each valve we has a ring like structure. Okay, and for example we have a door. Okay, and for a door we need a frame. Okay, so this ring acts as a frame for this valve, so it provides attachment for this valve. So first function of the fibroskeleton of the heart is that provides attachment for the heart valves. Okay, and these rings support heart valves. In some conditions these rings are dilated. Okay, when they dilate, okay, they causes uh, prolapse and regurgitation of a valve. Okay, but anyway, another part of fibroskeleton is this membranous part of fibroskeleton, or this part which are between these rings. Okay, for example this part. Okay, now here we have two important uh, part. One membranous part connects these two rings, mitral valve ring and aortic valve ring, and this one is called left fibrous trigon. This is called left fibrous trigon. And here we have another fibrous part of this fibrous skeleton of the heart between these rings, which connects mitral valve, tricuspid valve, aortic valve, and mitral valve, and this is called right fibrous trigon. And here we have an important structure which is called AV node, because this is AC node. Okay, we'll talk about it in future lecture. This is AC node, location of AC node. These are internodal pathways, and these are specialized myocardium. They're not other types of tissue. This is specialized myocardium. So now this is AV node. This is AV node. This AV node is located here in this right fibrous triangle. Okay, and the only way to pass depolarization and repolarization from the atriums to the ventricles, this is the only way is that we can pass this depolarization and repolarization or electricity by the help of this AV node. Okay, so the second important function of fibroskeleton is that it acts as a electrical insulator between atria and ventricle, and it's very important because when depolarization and repolarization come here, they cause contraction of atria. Okay, and when this depolarization and repolarization passes from the atria to the ventricle, it needs a bit time. Okay, so it will give a lot of time to contract and complete. It will give time to these atria to complete their contraction. Okay, then this electricity will come to the ventricles, and ventricle will pump the blood. So first these two are going to contraction phase or systole, and then these two are going to contraction or systole. So it means in in, in simultaneously and in one time all of chambers are not going to contraction, so it acts as an insulator, as an electrical insulator between atriums and ventricles. This is the second function of fibrous skeleton. Third function of fibrous skeleton is that it provides attachment for the chambers of the heart, and chambers of the heart will be attached here to the fibrous skeleton. Okay, so this was about the fibrous skeleton of the heart. Now let's talk about the coronary circulation of the heart.